is people are just given, you know, band work. And I get that feedback all the time. You know, my patient will be like, oh, so this other physio gave me, you know, this set of exercises, but they didn't work. And I find that what physios are lacking is trying to get across that knowledge to their patients about why exactly they're doing that exercise, or what's that intention of that stretch? What are you trying to feel? What's your actual goal with these exercises? Because I find that people will do them, but if they don't understand why they're doing it, they don't see the results. And I find in general, that's definitely a weak spot. And this might speak to all the professions as well, is giving that education piece. I find that sometimes as physios, we're just so keen on doing the manual therapy and doing the exercise program that we actually forget to take a step back and just explain, you know, what it is that you're feeling and why you're feeling it and how we can actually help you. So that's something that I'm definitely working on day to day.
Lovely. Yeah, being a physio and an osteopath, I'll just show you my, you know, the cons. I mean, I'm always a pretty critical person about what I know and what I think exists out there. It's lifelong learning, you know, so I'm concerned about the physio, the chiro, the osteopath who isn't studying on a daily basis. Like I read every day. It's part of my fabric. It's like exercising. It's like brushing my teeth. And it's a lot of it's spiral learning, which means you go back to the things that you've already learned to gain a stronger understanding and better application process. So, you know, to me, that's what people should be looking for is, am I looking for a practitioner who really practices what he preaches, right? Does this person, I don't care if it's a physio, chiro, are they constantly taking courses? Do they really live this life of a healthcare professional? I take that quite seriously. But one of the things in the osteopathic profession, I find that I can, there's a lot of great things, but they'll say, you know, I can treat you, everybody needs an hour and a half treatment, and I can solve your problem in 2 visits. Well, then they must have magical hands, because, you know, I don't know, you know, how much time you treat with somebody is really dependent on that person. Sometimes I can treat somebody in 25 minutes, the next person it's an hour, the next person's half hour, sometimes it's 45 minutes. You really have to, it's client-centered care. It's not a protocol. It's a process of that you have to deliver to that particular patient. The next patient comes in and it's a clean slate. And to your point, Caroline, we're just facilitators. You know, this is a very interesting forum that we're doing now with the COVID and social distancing. But one of the things I mentioned on our chat last week, which across the physiotherapy community across Canada, was that I study a lot of the history of medicine, which is like the history of not just physiotherapy. We're talking like medicine going back 200, 300, 500 years. Our role is to facilitate. We have to make our clients, our patients, their best patients. So it requires exercise. They have to understand what their problem is. They live in their body. We don't. So when you go to your doctor, it's the same thing. When you come to see us, whether it's a chiro or physio, it's the same idea. This is what the problem is. This is what you need to do at home. And this is where you're going to get better. And at the end of it, we have just facilitated, and they've done a big chunk of the work. Because if they see you once a week, what is that? 99.5% of that week is not with you. It's with their body. They got to know how to carry it through. So now we're on a platform of virtual care. Is it really any different? The only thing we're not doing is touching our clients, but we can observe what's going on. We can facilitate what they need to do at home. And that is very powerful stuff. And really should be the message going when a patient leaves the clinic. I always say when they get in their car, they should think, okay, I went in with a plantar fasciitis, a foot problem. Do I have an idea of what my problem is? Is it really in my foot? What tools do I have to work on this? That's the key. And I think that's what you get at the sports clinic. You know, we're here to help you. We're not here to do everything for you. We're here to basically make sure you know how to manage it on your own. So that's my 2 cents.
Kev, is the for osteopathy, because this is a question that I always had, especially when I was like a physiotherapy student back at U of T, and I was interested in what osteo was. Is the training the same across the board?
No, my God, good question. it's not a regulated healthcare profession like chiropractic and massage and physio and MDs. So it's, when I say relatively new, it is relatively new to Canada. There's a bunch of different streams, but there's some programs in Toronto that you can go for 6 months or a year, and all of a sudden you have no background, and you've gone from being, and this is no disrespect to a personal trainer because they have a skill set, but all of a sudden you're an osteopath within 6 months or a year. I mean, my schooling took almost 10 years, and trust me, it wasn't perfect by any stretch of the imagination. It tends not to be the same organization as a university-based system because they don't have the finances. So, but there's a lot of brilliant osteopaths having smaller schools out there that are really producing really good work. Unfortunately, they're trying to gain acceptance amongst all these other professionals who I think don't want to share the spotlight sometimes. So I'm lucky personally that I'm a physio, I'm an osteopath, we all practice acupuncture, Jeremy and I are doing functional medicine, and that's all being taught by chiropractors that have masters and PhDs, and these guys blow my mind. So it's kind of, I like to learn from a lot of different healthcare professionals because it helps me. So I always say, careful what osteopath you go to. Look at what their credentials are. Careful what physiotherapist you go to, because those are in my kind of wheelhouse. They should be spending time with you, empowering you, and facilitating your health. It should be all hands-on. I always say, these are our tools: our hands, some acupuncture needles, and exercise, and our brains. We should be able to figure it out. And if not, we're going to use other healthcare professionals like your doctor to chime in and help us out if we need diagnostics, right? So it really is a team approach.
Caroline, what are your thoughts on, like, once you get a good physio and a good chiro and you observe them treat, do you find it hard if they're a good practitioner to like find the difference between the two?
Absolutely. Yeah. And I tell my clients that all the time because I think, like you said, Jeremy, we get on a daily or weekly basis, what's the difference between physio, chiro? And I like to tell my clients that it's actually more about how we're alike than we are different. In what Natalie said, the old school chiropractic way was, heavy on adjustments only. And it used to be the fact that, physios didn't necessarily do adjustments. But now with a lot of the training that we're doing with manual therapy, if you ever see a physiotherapist that's this intermediate level or FCAMP, which Jeremy and Kevin both have, it means that we are trained to do adjustments from your neck all the way down to your feet. So once you find a really great chiro and a really great physio, I find the difference is down to almost personality and fit more than it is about their actual skill set. And I know you and I have talked a lot about that, the fit being so important with client and therapist relationships. It used to be that I would hear, oh, my chiropractor, I'll go to my physio for exercises and my chiro for adjustments. And that's totally not the case anymore. And I think Natalie would agree, right? Where you're also very heavy on exercise prescription now. So the difference is so minimal.
Yeah.
Yeah. I find that the difference was like, it's kind of almost like historical difference. Like when I always describe it, I'm always like, well, by history, like physio was like muscle and strength based. And then chiro was like you said, like adjustments and joints looking at it. But now we just really blurred the lines because you guys are all trained to be FCAMPed or like on your way that way for manipulation. So like you guys are also joint focused as well, which changes things up.
And also, one of the things I'd like to add too, guys, if I can, is look at the physio profession. I said I'm very outspoken about my profession. I love it, and I think it's our job to basically educate the public about what's good and bad. And I don't think it's not that we're not being professional. It's about we're educating people. You can go to whoever you want, but these are the things you should look at. Traditional physiotherapy, ultrasound, ice, heat, all those modalities, and it was very little hands-on. And if it was a little bit of stretching. And so it's completely evolved. So I always tell clients, the ice and the heat, you can do that at home. You don't need to pay anybody for that. And so you're seeing, we're trying to kind of challenge or dismiss that there's a lot of physios that still do that, but those aren't the better physios. And I know we, bunch of us treat a lot of physicians, and that is the biggest stigma I'm finding with the medical profession, because they feel like that's what they know. You guys just do, you do just, ultrasound and heat, and that's not what we do. And next thing you know, when you start treating them, they're like, wow, they can't believe the level of knowledge and the time that we spend with clients and how thorough we are. And next thing you know, they start referring their clients to us because we're here to help them out too. So as much as I always say, as much as people think the chiropractors have a certain, message, maybe they're just adjusting, you're in and out in 2 minutes. The physios are no better. They're like doing ultrasound on you, which doesn't work, and putting a heat pack on you, which you can do at home.
Yeah, that's well said. And the other thing that I like about it, and having Natalie on the team at UTM, is some people have, $500 coverage for physio and then $500 for chiro. Having someone like Natalie on the team makes it super easy. Even if it's like, listen, it's a calf muscle problem, a chiropractor can also work with that. So I can easily transition my caseload into hers, and she can carry on the plan of care and do this very similar work because she's fully capable of doing it. And this way people can use their benefits a little bit more appropriately so that they can use them up, right?
Uh-huh. The one thing I'm also finding with the chiros, which is I tend to gravitate towards now as a physio and osteo, is some of the chiropractic colleagues that I'm in association with, and Jeremy probably jump in on this as well, is they're really getting into the functional medicine world, which is, labs, blood labs. They're looking at stool cultures. They're really understanding the interrelationship between the nervous system, the immune system, the hormonal system, and that role with everything else that we do. And that's what interests me, because the more I get into that, the more complete picture you really do have you need to spend a lot of time with people to really get through this process of when this person comes in, how is their diabetes affecting this problem? It really starts to peel layers of the onion away. But if you asked me this 10, 15 years ago, I wouldn't have a clue how to jump into this stuff. So that's where lifelong learning comes. And I think that is an absolute prerequisite of working at the sports clinic, is you have to be able to push the envelope in terms of your mind, in terms of what you're bringing to the table to help people out.
I got a question from the chat from Karen. Are there conditions that chiros don't treat? Example, meniscus tear. I think this is a great question. It elaborates on what I was just saying. I use the calf muscle strain as an example, because a lot of people are like, it's got to be neck or back, right? Otherwise, chiros don't do that. And that's obviously a big misconception. I'll get Natalie to elaborate on something like a meniscus tear. Can you treat something like that, Natalie?
Yeah, definitely. So a lot of the treatments are quite similar to like what our physios do in the clinic as well. So it'd be hands-on as well as exercise-based progressions to get them back to whatever the activity they liked, whether it was like walking, weightlifting, or something, any sport specific movement. I find that like a lot of times we're kind of the spine people, just because people see whatever's on YouTube with some funky adjustments that look cool and sound fun. But there's also like hands-on work that we do with like, joints, your knee joints, your ankle, and just throughout the entire like lower body as well.
Perfect. So guys, we have about, I think about 5 minutes or so. If there's any questions from people that are logged in, you can unmute yourself and ask the question. We'll hang out for a little bit. And if not, we'll still hang out. Thanks everyone for coming in. This Saturday at 11 a.m., I'm going to be doing a webinar on the home ergonomic setup, where I'm going to let you guys in to my own space, what I've been doing, because I've been doing a lot of long hours on the computer, more than ever, really. I'll just show you guys some tricks on how to set that up. And it kind of goes hand in hand with what I did last Saturday, which was the stretches. So if you start doing the stretches before and after a long computer day work, and you set up your ergonomics a little bit better, you're going to have better postural outcomes, and you're going to need to come in and see us quite as often.
I saw a question there on one of the chats, is to define functional medicine.
Hello, Jeremy.
Hello?
Okay, come on.
Yeah.
Hello?
Hello?
So the functional medicine question, I think that's a heavy one. If someone wants to come in and ask a question right now, otherwise we will, but I think that's a tough one to answer in 2 minutes. And guys, if we do get cut off, We'll pick up where we left off on Saturday. Don't worry about it. These things cut off at about 40 minutes.
Saturday. Okay. Okay. Thank you.
Yeah. Did you have a specific question? We still have time. We'll keep going until we get cut off. That's fine.
Okay. So I'm just asking about the same thing. Like Saturday, at what time is the ergonomic setup? That's what I want because